Guys, how's it going? Corey Partridge here. Um, Going over discussion week 5. Why is having a working knowledge of anatomy important as a paramedic? Man, that answer could be unlimited. Um, One of the big things, obviously, is with anatomy, knowing the anatomy of the body, knowing the bones, knowing distal, proximal, posterior, anterior locations in relation to injuries, and um, that's really important because knowing where a bone's broken is important, and what bone broken in relation to other bones. And for instance, if you break a rib, the ribs protect the lungs. Well, if you break a rib, you could puncture a lung, you could cause lung injury. There's a bunch of reasons. Also, knowing as far as documentation, knowing being able to label, the different parts of your chief complaint or mechanism of injury in relation to trauma. Also, when it comes to illnesses, nature of illnesses, not just how the anatomy of the airways, and when it comes to breathing and maybe intubation, and how that whole system works. So there's documentation, just knowing that, and then when you're giving a report to another, and um, or giving a report to receiving facility, whether it's a nurse or a doctor, just knowing the anatomy of your nature of illness or your injury. That way, when you do explain it, you can use those terms and you're not embarrassing yourself. So, yeah, that's another big reason to know the anatomy, um, and just knowing it because of being able to, paramedics are problem solvers. So if you have uh, a, if you go on a call where somebody's complaining of an abdominal pain or, difficulty breathing, if it's an abdominal pain and they're pointing to where they're hurting, you know, kind of that area, what organs are in that area and what, life threatening issues that could be in that specific location. Or if, somebody's having trouble breathing and you listen to the lung sounds and you hear diminished on one side, but good on the other side, that could be a problem. So just to knowing the anatomy and just is very important. So that's how I feel about that. Um, I'm sure, hopefully, y'all have different answers and not similar thoughts on this. Okay, bye.